My idea why I decided to record this video, as I mentioned before, I mean, I have YouTube channel and sometimes I download videos about psychoanalysis. I'm not psychoanalytic, I told you, but this is kind of field of my interest, special interest. But I am also interested in existential direction, yeah, in psychology. But what complication there is in psychology, to be honest, it doesn't depend on any direction, that there are many theories. Yeah, many theories, many different understanding of nature, of human being nature. So, and if you remember these questions I was asking you last semester, yeah, about human being. So the question was about if a person can change, so how he looks like, how I understand this person, does person free in his choices, and etc. Yeah. And your answers probably were different. Not probably, I'm sure they were different. Some of you believed, yeah, that, oh yeah, the person can change. It doesn't depend even on the age, experience and environment. It's like ability that we have, for example, yes. But some people, as you answered now, yeah, you're saying it depends on the age, it depends on some factors. So it's not like if I want to change, I can change, yeah? Am I right? That was your answer. So what complications there is in psychology? I told about this since many times. So we see the person, the human being, we see from different perspective. Okay, so and it doesn't mean that you're right, you're wrong, for example. So this is a different way how we understand another person. But this question I was asking you when I kind of what course? Individual counseling. Yeah, when I was reading this course, individual counseling, that it's really important for counseling how you see another person, how you understand actually another person, because the way you understand another is equal, is the same as you understand yourself. So did you get it? Do you remember, yeah, this idea? I several months told you about these things, yes? And in that sense, that means how I understand myself, what I think about myself, how I understand my possibilities, limitations, and etc., how I see my own human being, my human nature, and etc., the same way I will be treating your soul. Psychotherapy, counseling, okay? The same way. So it's not working, for example, if I'm telling you, okay, guys, yes, there is unconscious, yes, and if I believe in this, it doesn't mean that you also believe in this, yeah, but it's easy, we can prove, yeah, the existence of unconscious because we don't, for example, keep everything in conscience, yeah. And it's easy, for example, now I can see immediately, so not every one of you are here and now, yeah, and if I'm asking you a question, you're not answering. That means it's metaphorical, it's not like you're unconscious and don't understand anything, but that means your attention is somewhere outside of this room. And when we kind of live our life, of course, we are not always keeping attention on something, yes. So this psychoanalysis was telling us about this unconscious, but I believe also in this thing. And for example, if you do in counseling, it's very important. If you believe in this, you will do the same thing with your client. Yeah, so it's like you understand that he has this unconscious, and etc. Okay, and so it depends from this. It depends on the theory of personality, I would say like that. And complications, that there are many theories. You had this subject, yeah, psychology of personality, and the problem of psychology, to my opinion, that it's so we look at human being only from one perspective, psychic, yeah, psychological perspective. It's already narrow because there is a world, there is life in this world. Not only we are people who are alive, yeah, there are animals, nature, universe, and etc. Understand, yeah? And I mean, we are alive. It doesn't mean that we exist only in this field where only we exist in. So it's like understand this idea. It's very important. Just be very careful with these things, because university system built like that, that each subject you study, it looks like from the first point of view, it's like from the first sight, it looks like different, yeah. So it's like one doesn't depend on another. Yes, it's for you, it's like that. What did you study? System theory, psychology of personality, social, but you study only psychology. That's a thing. And you see, when you study psychology, even here, all subjects for you looks very separately. But the whole university system now, it wasn't before like that in Russian-speaking areas, but now it's like any subject you study, any subject you learn, each subject, I mean, in competition. Physics, chemistry, math, psychology, astronomy, and etc. I mean, it's not, of course, in competition, but it looks like we see these things, it's like, oh, they're not connected. Did you get these things? But they are connected, of course. Of course, everything is connected. If you learned, I don't know, chemistry at school, you have to understand, yeah, that the world has all these elements, yeah. The water you drink is H2O, yes. So, and I mean, you don't need maybe this knowledge to create some experiment, but anyway, chemistry is everywhere, yeah. Physics is also everywhere. So, because there is earthquake, it was recently, yes, it's like about geography, astronomy, physics, because everything depending on each other. Yeah, the moon influence on Earth, you know, yeah, this thing. So everything is connected. So it's not like one thing is separate from another. But what psychology makes, to my opinion, I mean, I don't know about other subjects, but psychology, we kind of study psychology. So we look at human psychic. So you see, it's already narrow, it's only psychic. But how it can be, and in this psychic, there is also very, very, very narrow view how we see another person. So that is why you have to understand all subjects you learn here, they are all connected. So it's not like if you, for example, you're studying, I'm absolutely sure you're studying system theories, because this part of system theory I'm telling you about, the system theory. So do you know these things? So in that sense, it's like everything is connected. Psychology of personality, you study many theories, yeah? Developmental psychology. Yes. You know how the person kind of goes through his life in terms of age, how he is growing. It doesn't mean that one subject doesn't depend on another, yeah? Individual counseling. So this part of psychology where we understand another person, we have to know theory of personality, we have to understand how, in which theory I believe, yeah? And in that sense I can do this counseling, yeah? And this subject name is clinical psychology. Clinical psychology, but clinical, as I told you before, yeah, on our previous lectures, so it's about something abnormal or deviation, so it's not normal. So the concept of normality, now we understand it in a little bit, how to say, different way. But for example, last century in 40s, normal person, normality, concept of normality, that means like, oh, you can achieve some, I don't know, in terms of Abraham Maslow, self-actualization, yeah, or that you are very successful, I don't know, that means normal. Now this concept is changing, okay, and our subject is about personality, but we have, in this personality, we have many things. Not only the way how we see the other person from theoretical perspective, but also in our personality, as you answered before, there are some other bases, so it's like a structure of personality. Structure that depends on many factors. We have physiology, we have cognition, yes, we have soul, psychology. So it's very important for you, you have to start think systematically. Why I'm telling have to? Because on psychologists there is a little bit more responsibility, because from first year of education you are trained to see another person from different perspective. It's already systematic. But you have to build this relation between other subject and between your life, yes, and between nature and between, I don't know, other human beings, animals, and etc. yourself, because you are part of this existence. So it doesn't mean that only psychology it's the main thing, but you kind of study psychology, but you're also part of human being existence. So in that sense, ecological problems we have now, we are responsible for these problems, you know, yeah? So everything is systematic. And try to create this connection yourself with other kind of subject. But what I will try to do in clinical psychology, I at least try to, inside of this subject, I will try to create you this connection. But I can't create this connection with your own life, because it's your responsibility. But anyway, everything is connected. Okay, clinical psychology. The name I mentioned before, Otto Kernberg, he is a psychiatrist actually. But he is really, really famous, and in that sense, how to say, well, I like his structure of personality. Not only like, I actually believe in this structure of personality, but he belongs to psychoanalytical direction. I'm not a professional in this field, but he was speaking about object relations theory in psychoanalytical direction. He is one of the representatives of this school of psychoanalysis. And he is clinician, of course. But the first thing I want to start with, before I will give you this clinical structure of personality, clinical, let's call it like that, yeah. But anyway, it's a structure of personality, and one of this part of this structure belongs to clinical psychology. So it's borderline personality. We are speaking about this, yeah. But first, I will tell you about his structure of personality. The first thing he is talking about the basement of this personality. So personality is like an umbrella. So he uses this term umbrella concept. So it consists of different things, yeah. And one of this part of this structure, okay, look at your schemes and tell me what this part. You are answering. Actually, your structure of personality also was looking like a structure. Remember, you kind of highlight different ideas. Yeah, so it was different. There is biological part of my personality also, because my appearance, for example, my weight, height, it's also physiology. Yeah, and it can influence actually on my personality. What we have as a legacy from our parents, it's biological basement of your personality. You don't know? Type of your blood, actually. But it's not about personality. If you believe in this theory, probably you know, yeah, these types of personality, sometimes they divide, yeah. The first group, they behave like that. It's about types of personality, but it's not about that. So what I'm trying to kind of ask you and pay your attention, that our personality has structure, and we have a biological basement for this structure, and based on these biological features, let's call it like that, you can develop these other things, like to be aggressive, extroversion, introversion. But before, I mean, the basement, it's not only about genetics. Yes, yes, bingo, finally. What do you know about that? Temperament. Why temperament is really important for my personality?
Because it affects our thinking and our behavior.
How? Yes, 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 it's exactly like that.
How we react to some circumstances.
So it's your nervous system. And you know that temperament is biological, yeah, basement. That means there is a speed of your reaction. Yes, there is irritation in how you're able, yeah, to come down fast or slow, if you're very flexible or not, yeah, stable or not, understand, yeah, these things. And if you're, for example, processes are very fast, of course, it influences on your cognitive experience. You will remember, yeah, faster, for example, than person who has another type of nervous system. And on temperament, so next step, yeah, after temperament is your features, it's your character actually, but I won't talk about character right now. So it's what Otto Kernberg is talking about, because he belongs to psychoanalytical direction, as I mentioned. He told, for example, when you are born, when you come to this world, you have your biological, yeah, basement. It's like temperament. So how you react with this world, with other people, how you react on your internal stimulus. But infant, he doesn't see the difference, yeah, between internal and external things. So when you are small, when all of us actually, when we come to this world, there is no border between what I have inside and between what I have outside. You have learned these things on other subject. I'm absolutely sure it's developmental psychology, it's general psychology, yeah? And I also told you, yeah, about these things. And in that sense, my life literally depends on whom? Parents, yeah. So it's, but it's not usually parents, because not everyone, yeah, in this life has parents. But it's about it's psychoanalytical, yeah, term, significant others. So significant others. So this person creates me my world actually. So he is really responsible on my life. And because if I'm hungry, I don't understand that I'm hungry. Yeah, I'm crying, for example. And if my, let's call, okay, mother is not like significant other, but we keep in mind, yeah, that our mother is significant other. So if my mom is near, so she reacts, yeah, on my signal that I'm hungry. So what usually infants do when they are hungry, they feel uncomfortable, so they always cry. You know, yeah, because they can't, I mean, they can't speak and they don't understand these stimulus. You have to keep this idea in mind. It's really important for this different type of personality. Just keep it in mind, okay? So, because infant, we don't understand, we doesn't kind of see the difference between stimulus that goes inside of us or outside of us. So if I'm cold, I'm just crying. If I feel hungry, I'm crying, and significant other comes to me, yeah, and feeding me, and then I'm kind of relaxing. Yes, okay, the world is safe. And this kind of interaction creates different effects. So there are different affect systems. Yes, it's, for example, fight or flight, yeah, reaction. When I'm infant, my mom created me, yeah, this affective system. And if, for example, I'm crying and she is not responding, then what?
Trust issues, maybe.
If to remember Erickson, yes, trust issues, but if to talk about biological things, try to think what effect we have, what emotion, what I feel if I'm not kind of getting immediate response. I'm not comfortable, yes, I'm crying and there is no anyone near. Anger, yes, so it's anger and fear and yes, anger, fear, yes, it's and anxiety. Anger, fear, and anxiety. So, and I think you kind of know these theories that comes from this idea how I interact with significant others, because they were very popular several years ago. I'm not sure if it's popular now or not. It's attachment theories. Try to, in terms of effects, try to think how you usually interact, how you build relationship with another person now when you're adult already. And for example, if someone is near or you are losing someone, yeah, so it's about trust issue, of course, but do you trust or you don't trust? Can you build this relationship or you can't build? So is it difficult for you to have friends now, or it's not difficult, you have many friends? So I think it's not necessary to answer. Understand? Yeah, this idea. And it's only one part of your personality. So from this perspective, from Otto Kernberg's perspective, temperament is biological, yeah? Basement for our personality. It's only one part of our personality. But you see, if only temperament can influence, it's like on your interaction with other people, it's only one part. There are also others. So did you get it? Mm-hmm. Okay, so another one I already mentioned, character, yes. It's different type of character. Why we have different types of character? So some features I, of course, develop during my life. But if you know some definition of character, usually in general psychology, they are telling about this definition. Okay, yes, behavior. Character is kind of how we behave. So it's a kind of definite pattern, how we behave in different situations. And probably you, not probably, but I'm absolutely sure you know this different type of character. It's like sometimes people say it's hysterical, schizoid. Do you know these terms? Paranoid. Do you know the name Lichko, for example? The Soviet, actually, psychiatrist, and he was studying, we had before this term accentuation, and there is no equivalent in English, accentuacja. So, and he was studying these different patterns, how teenagers behave. So they have different character, and in that sense, epileptoid, schizoid, and etc. This type of accentuation. So it's an old actually system. So there is, for example, character. Okay, let's call it here. It's like something normal, and here it's very. So some of your features are extremely, how to say, kind of show them everywhere, always, and you can't control, because usually if everything is okay with you, from coming back to clinical psychology, as I told you many times before. If everything is okay with you, you can understand what I'm talking about, you can answer on my questions, yeah, and you can control some things in your behavior. If even in your family are allowed to, for example, show aggression, but here and now you won't show this aggression if you don't like it, yeah, because you understand that here you can't do. This is university, so you can control this feature. But not everyone can control this feature. And before we had this term like psychopath. Sociopath. Did you hear? Now we don't use this. It's an old term. It came from German actually, psychiatry. And Andrei Lichko, he based on, of course, on works of Emil Kraepelin, and it's German classification, of this type of character. So accentuation. This. So it was only in Russian-speaking areas, because in English-speaking areas they didn't talk about accentuation. In German psychiatry they also didn't talk about accentuation. So it's something between. Yeah, that these features are kind of more highlight. But anyway, can control. But psychopath was a person who can't control this feature. So, for example, epileptoid psychopath, he behaves very angry. It doesn't depend where he is. For example, if some of you were psychopathic, in all this classification. You are angry here, you are very unstable, so very easy. For example, if I tell something, you easily can become emotionally unstable and show this aggressiveness. They're very detailed, they can't switch attention, they're very rigid. So this characteristic of this epileptoid type of personality. There are different types of this psychopathic personality. Before, we use this term psychopath. Now they use another term, different type of personality, borderline personality, psychotic personality. But if to continue this idea, why they were talking like that, because it's old school, of Soviet psychiatry, let's call like that. Because in terms of psychopathy, this is character, so no control. I'm very rigid. That means psychotherapy, counseling. Remember, we were talking about this since last semester in our class of individual counseling. So counseling works only if I want some changes in my life. So in that sense, if you believe if person can change or not, that's actually one of the way how we can do psychotherapy. Because if you don't believe that a person can change, then it's useless, to do psychotherapy. So, but in general, of course, we have this ability to be changed. It depends on your temperament, of course. If you are, again, if you are very flexible, it will be easier for you, to change something, to have this adaptation to new environment and etc. But in terms of old, this Soviet psychiatric school, in terms of psychopath is very rigid. You can't change. So in that sense, you have definite pattern and you can't change it. Understand? So that is why they were telling like that. Oh, it's like, just do something. But don't try to change his behavior. We are talking about character, and you told yourself that character is behavior. So he can't change the pattern. So probably he, for example, will stop use some drugs, or alcohol, but my attitude, how I behave with other people, I won't change, because it's very, very stable and rigid, and it depends also on biological things, on temperament. Okay, did you get it? Yeah. It's enough, okay? Just next. Identity.
How you identify yourself in the world, like how you represent yourself?
How you present, how you identify yourself. You see, I'm telling you that everything in this education is connected. And it's connected with your everyday life, because everyone has personality, everyone has character. Yes, everyone from this perspective, from this school, they believe that there is identity. So it's really kind of important term, identity. Just pay attention how I understand myself. So this is your understanding of yourself. How, for example, you understand your features, temperament, how you behave with another person, how you can, I don't know, interact with other people, you know your limitations, you know your possibilities. You think about this, how you understand yourself, do you know yourself, or there are some aspects that you don't know. Temperament, character, identity. There is also two more components in this umbrella concept of Otto Kernberg. This very biological thing, this we kind of form in our behavior, so nearest surrounding is really important, significant others. And this how you see yourself. It's actually also depends one on another. It's not like this part separate. Yes, again, I'm coming back to this idea that everything is connected. So this is like a system. Our life, our nature, our body even is a system. So we were talking about physical, body, physical characteristics that you don't have in your answers, physical self or physical I, yes, let's call it like that. But in our body we have also different system, like heart system, immune system, and blood system, and etc. So everything is connected. So how do you think? Two more components, cognitive organization, let's call it like that, but this fifth one, cognitive organization, he called it like that. You told thinking, but this only one part of this cognitive system, What else? Memory.
Attention.
Okay, actually he was talking about intelligence. It's literally about your intellectual ability.
Okay,
of course, our intellect depends on our memory and attention, because if my memory is really good, I can remember some things better, and in that sense my knowledge kind of become better. But this can influence on intelligence. But sometimes, there are such phenomena. It's also in clinical psychology. We will read this in book of Zygarnik, diagnosis of idiotia. So it's like your intellectual ability. For example, why I remember this classification, because one of my colleagues, she was telling me, she was a psychiatrist, and she was telling me that sometimes people with really low intellectual ability has really good memory. So, but when you, for example, start to ask them, they can't connect things. You understand what does it mean, intellectual ability, intellect, so intelligence. Do you understand? So it's not like really I know something, I have to also create these connections in the things I know. And this is really important, a part of our personality, because it actually helps us to connect all these things together. This also help us to I don't know, understand reality. So this really kind of strong part of our personality from Kernberg's perspective, I'm telling you. So he's psychiatrist, but probably you see here, it's very, in that sense, medical anyway. So he's a doctor. But we need it because we study clinical psychology. It's not like, it's not about normal things again. Okay, so cognitive organization and one more. Superego, yes, of course, superego. Superego. So superego is our ethical system, How do you think why it's so important?
Because it controls our behavior in society, what we can do and what we cannot do.
How do you think if I don't have this ethical system, or how, I mean, everyone has this ethical system, but it's, for example, undeveloped, what it can be in the term of psychology, So how it can influence, what consequences if my superego is not so strong, I would say, I don't know. If to look at human being nature on different people, how do you think, who doesn't have this superego, who it can be? We have these cases in our life. Who? Politicians? No, they have superego. Yes, of course.
Manicure beats.
Yes, it's like killers, sociopaths. Yes, people who kill actually. Why I'm kind of telling this is because this is Kernberg's theory again. I'm telling you, and he was he is a doctor, he's a psychiatrist, and he did a lot of therapy with people who did some, crimes, who committed some crimes. So serial killers and etc. And in that sense, for example, from this perspective that we can we can be changed, yeah, and in that sense, psychotherapy, why exists, yeah, just to help me achieve, yeah, this change. But Kernberg says, for example, that some people with them we can't do, yeah, the therapy because you can't you can't raise this superego if a person already adult. Do you remember, yeah, when this ethical system is developing, what age? Superego is a legacy of Oedipal complex. So by the 6 years, you already have to have your superego. It's an analytical concept again, I'm telling you. You have to keep it in mind. It's not like you have to follow, yeah, this idea. Anyway, if it's not about superego, it's about our ethical system, literally. I have to understand what normal, what is not, that I can't kill you, for example, I can't steal from you, yeah? It's ethical principle that we have in our life. And when we are small, according to Freud, the superego develops at by the age of 6. So this is legacy of your Oedipal complex. Actually, your superego is a superego of your parents. This idea of Freud, because they kind of graduate you, they teach you what is good and what is bad. In that sense, if a person already become adult and he is killing, it's really, so he can't understand that it's forbidden, yes. And sometimes this person has some also psychiatric diagnosis in terms of diagnosis, yeah. Not always, but it happens sometimes. This is structure of personality. And why we consider this in clinical psychology, because now it's very, very popular in psychiatry, in psychology. Even people who don't study psychology, they use this term, borderline personality, narcissistic personality, malignant narcissism. Actually, it's also kind of very popular term now. You know this word, usually people from, other specialties also use. Other people who even don't study anywhere. Narcissistic personality. Narciss. It's very fashionable now, to be honest. But originally, you have to understand that this term coming from clinical field, actually, from psychiatry, from clinical psychology. Originally, it comes from Freud. But Freud described this idea not like a diagnosis, but as part of our development, so narcissistic stage. Yeah. Jacques Lacan, for example, also was speaking about narcissistic stage in our forming of our identity. Yeah, this is one of the stages. But why we need it? Actually, because it's, so this is normal. Not normal, this is personality. But there is something that can become not, let's call it like so normal, yeah, or may function not okay. Then we are talking about abnormal psychology, yeah, or we are talking about different diagnoses. That was before, yeah, just as an example, we were just, discussing, yeah, this is killers, for example, serial killers, sometimes they have some diagnosis, sometimes they don't have, but they have some complications with superego, for example, so they don't understand that to kill another person is not okay, yes. I don't know, if you have some difficulty in understanding of your identity, what influence it can be on your life? How do you think? In terms of, try to think in terms of clinical psychology, probably just in terms of psychology. If you don't understand yourself, if your image of yourself not so kind of clear for you, you don't understand these things. What consequences can be? Because clinical psychology, it's about consequences, actually. Or there are some cases where when person, he can come to this world with some I don't know, maybe you have heard this term disability, yeah? And it also can influence on the personality, yeah, because some part can function differently than other parts, but
it can lead to anxiety, depression.
Anxiety, depression, bipolar disorder. It can be, yes. I mean, some diagnosis can come, yeah, from this actually ability to understand yourself, yes. Can come from your relationship with other people, yes. Can come from the stress that you kind of have to cope during your life, yes. And you know, it's very also popular idea now. Another very fashionable word is trauma. Everyone had trauma. So I mean, it's really fashionable, but not everything is trauma. But in that sense, if for example you were abused, physically abused, sexually abused, morally abused when you were small, it can influence, yeah, on your identity. You will see the world in different, I mean, in definite features, yeah, and it can influence on some interaction with other people, and it can cause you some problem later, yeah. Probably you have some, I don't know, depression, yes, if you can't build healthy, in that sense, relationship with another person because you don't trust, you're afraid of, and etc. Or if we are talking about some diagnosis, you know, that mechanism of dissociation. Have you heard this mechanism? It's a mechanism of defense. According to Kernberg, also, yes, mechanism of defense, this part of our personality, which defenses we use or not use, or use more often. And in that sense, for example, dissociative mechanism, that usually happens with people who really suffered from trauma, and one part of my psychic is like the part that suffered, yeah, it's like separates from another part, yeah, and sometimes literally it can be like the cases we discussed, yeah, this book last Tuesday, Billy Milligan. So sometimes it can create some personality, literally several personalities, yeah, yes, and we are talking about diagnosis. So this is how our structure of personality looks like, according to Kernberg. But from clinical perspective, what I'm trying to tell you. So before, for example, in psychology and in psychiatry, we were talking about people who who are okay, who are normal, yeah, and who has, for example, neurosis. So some symptoms. So everything is okay with me, but if some stress happened with me, I don't know, I can somehow have to deal with some consequences. For example, I start to wash my hands more often than I did it before. It's obsessive, yes, symptoms. But I don't have obsessive compulsive disorder. Yes, but some people, for example, they go literally with some diagnosis, like, for example, Freud's patients, yeah, they suffered from hysteria. Lacan's patient, Jacques Lacan, yeah, his patient suffered from paranoia, yeah, so different disease. So it was kind of really interesting that if it's like a line, let's call it like that, yeah. So there is something we call normal, there is something that extremely abnormal, yeah, but they didn't think that there is something in between. So Otto Kernberg create this term borderline. So, and this belongs to him, but in this psychoanalytical anyway level of organization, you told me that you have heard about this. Neurotic, borderline, psychotic. Have you heard, yeah? So this belongs to him, this, how to say, this separation. Not on two, but he added this kind of into the structure of personality, this feature that it's not always about being so normal or so abnormal. There is something in between. So sometimes we can feel ourselves okay, yeah, but sometimes it's kind of can be something happening, and I can really have some symptoms. Like, for example, my patients, I told you, yes, I work with drug addicts, and from that perspective, they can, I mean, this can be, they can be really moral, they can understand themselves good, but they anyway have diagnosis, and sometimes when they use some drugs, it can cost them by creating some symptoms. They have hallucinations, yeah, they have psychosis, and etc. So did you get it? But not always. And in that sense, he started to tell about these levels of personality organization. Borderline personality doesn't mean borderline personality disorder. So this is two different terms. I'm talking about now structure of personality. But there is disorder. We have such a diagnosis, yeah. But we are not psychiatrists, so we can't put diagnosis. But what we need, so it's really, I'm telling you, it's very common now scheme how we see the how our personality looks like. This is like levels of organization, yeah, of our personality. So if everything was okay, for example, I have to understand when I grow up, my significant others were near with me. They created for me safe space. And as we discussed before, if I felt anger or anxiety or something like that, yeah, they were near. So that is why I can cope with my these feelings. Yeah, if I, for example, feel anxiety, I can cope with it. Yeah, and I can build healthy relationship. I mean, I can build relationship with people. Yes, I have friends. I understand myself. Yes, and I know what I want. I can describe not only myself, but I can describe another person. I really see the difference, what is reality and what is not reality. Yeah, because, for example, in our reality, it's impossible to use magic. You know, yeah. If I will do some, I don't know, now voodoo puppet, and would put the needles in this puppet. So if I believe that influence on you, you know, this doesn't correspond to reality. But there are people who believe, and there are people who don't understand themselves, and whose relationship with significant others were not so good, or maybe they didn't have this biological parents. They were raised in some, I don't know, places where it was violent environment and etc. Then I have some definite features. Yeah, my identity won't be so good. So how to say, not good. So he created the term diffusive identity. Understand? Diffusive. That diffusion. I don't understand myself. Yes, clear. It's so in some areas I can see myself, but in some areas it's like I don't know myself. I can't understand another people. So and in that sense, we are talking a little bit about different level of this personality. So by default, is everything is okay? From this perspective, if everything is okay, we are on neurotic level. Understand? So I mean, it's not common to speak in this field between psychoanalytical representatives that we are normal. So they see this structure of personality, they see from these three levels. So did you get it? Yeah. So if I use a different mechanism of defense, different, yeah, if I understand reality, if, for example, I wash my hands 100 times, but I understand that it's not normal. I understand that I started to do it because of stress that I had recently, and this is my strategy to cope with anxiety. So that means I'm already not psychotic. So did you get it? But it still doesn't mean that I'm not borderline, because borderline is in between, so it's very difficult with this type of personality. But if I really understand the things and myself, then I'm neurotic. So did you get it? Mm-hmm. With borderline is like between with psychotic. So borderline personality, sometimes, for example, these people can understand themselves, but sometimes when some situations are happening, they kind of start to demonstrate some psychotic symptoms even. As I told you about my patients, yes, so probably kind of they had this neurotic level, but when they start to do this substance, yeah, they use some substance, mm-hmm. So they start to use drugs, yeah, they can be very emotionally unstable, yeah, they become irritated very kind of fast, they have extremely high level of anxiety when they don't have this substance. And in that sense, they can't use all mechanism of defense. They use mostly primitive mechanism of defense. It's like.
Question: I heard that people who have borderline disorder, they have high level of empathy. Is that true?
It's not directly true, but I'm talking about borderline personality, not disorder. So again, just be very attentive, because it's really not so clear, because this is terms, and sometimes people really don't understand these terms. So from Otto Kernberg's perspective, from psychoanalytical, psychodynamic perspective, our personality, it's not a disorder. This is personality, but this has different levels. Mm-hmm. So in that sense, if I have diffusive, my identity is not clear, not clear, doesn't sound really good, yeah? So if I don't understand myself really clear, I can't describe myself, I can't describe another person. That means some complication with identity. That by default means you are not neurotic level. Because you, I mean, on neurotic level and on normal kind of way, let's go beyond this neurotic. Yeah. Anyway, let's talk about just healthy. I don't know, normal person. So I understand myself. So if if you ask me to describe my friend, or some of my significant others, my mother, father, I don't know, grandfather, I can describe. And it won't be contradiction in this description. But with a borderline level of personality, it will be contradiction. For example, if you look at the answers of your Who Am I test, probably you will, if you see, for example, the answer I'm kind and the other answer I'm aggressive, this contradiction, it doesn't have to be like that, because it's not logical, yes, understand? But if to talk about empathy, so there is such concept that people who demonstrate antisocial behavior, they used before the term sociopath, yeah, but antisocial behavior, they have some complications with this empathy, so the lack of empathy. But for example, I have heard such kind of things from psychiatrists that people who have some diagnosis, psychotic diagnosis, not psychotic, some psychiatric diagnosis, they're very sensitive. So very, very, very extremely sensitive. But I wouldn't say that there's empathy. So empathy, do you know what does it mean? So it's like ability to understand what the other person feel. Yeah, maybe it's like some confusion in this idea that borderline disorder, I don't know, not maybe they were talking about sensitivity, but not empathy. Because by default, if borderline personality, so you have some difficulty with your identity. In that sense, you are not able to understand also your feelings or the feelings of another person. It can be like that. And psychotic level of personality is easy, yeah? No tasting of reality, I can influence on the world. I can kind of put the needles into this voodoo puppet, and you will die. And if you kind of think differently than me, you are not okay. But with me is everything okay. So this one of the ability of a healthy person when we have to see this difference between normal and abnormal. So if we are talking about some diagnoses and some problems, we are psychologists, you can't speak about diagnosis, yeah? So that is why you can speak about some features, yeah, that a person have in his life, yeah, in his character, in his behavior, in the identity, in personality. So that is why I'm trying to tell you these things. You have to see this idea. So if you see this, it usually can be some diagnosis, yeah, because it's not, I mean, there is reality, no magic, I mean, it's obvious, yes, and it's reality. There is no anyone here near with me who is whispering something in my, I don't know, ear, what to do. You don't see this, and I don't see this. But if you telling me that you see this, but I don't, then I'm kind of crazy. That means opposite. Understand? Yeah, it's really very thin. Yeah. Fridge, yeah, thin. It's very fragile, this border between normal and abnormal. So, and especially with borderline, because they can be okay, they can demonstrate a really good understanding of the cells, how they kind of cope with this reality, with stress. But in some situations, I can influence on the world, I can do magic. And usually, if we are talking about psychotic level of personality, of course, usually it's easier to diagnose because they really have diagnosis. I mean, psychiatric diagnosis. But how to understand if person are normal or abnormal? We have to test reality. You understand, yeah? What does it mean to reality? We have to test his ability to understand himself identity. Yes, so it's diffusive or not. We have to understand, we have to test this ability of a person to be critical to his behavior. Because if I don't understand what I am doing, like I gave you the example, if I wash my hands and I don't understand that this is normal and you are kind of not okay because you don't do it 100 times per day, so you're strange. Mm-hmm. But we have to kind of test, yeah, this ability. I mean, and this ability to be critical to my behavior, to understand what I'm doing, it's already not about diagnosis, yes? So it's not psychotic. It's, if you are not rigid, it's also about being kind of closer to this neurotic. More rigid you are, so if you're very rigid, like this, yeah, people who demonstrate antisocial behavior, so they're very rigid, so they can't, I mean, develop already superego. So, and why I'm describing these things? Because he has really good idea how psychologists can use this equipment. He called this method, let's call it like that, like a structural interview. It's based upon psychiatric interview, but he added some of the questions that can help to psychologists to understand what level of personality you have, if even you are not in this paradigm. But it's really kind of good idea how you can understand another I mean, another human personality. Let's call personality. Yeah, we are talking another human being. Yeah, so what type of temperament? Yes, what happens with his ethical system? Can I do something with him or can't? How he is functioning on cognitive organization, and etc. And he built therapy based upon these things. So what they do in therapy, they call the school as transfer and focus therapy. It's very popular now, school and direction in psychoanalytical, in the psychodynamic direction. So when the first they kind of do this diagnosis, let's call it that. They put this diagnosis when they do this structure interview. But when after you become part of my psychotherapeutic intervention, for example, if you come to psychotherapy, so the idea is like this is the way of how you grew up. So the idea, if a person, for example, has psychotic level of organization, that means in therapy with him, I can kind of come with you till this, probably not this, but at least this level. So they do it in therapy with the help of relationship. I mean, psychiatrist creates relationship, yeah, with the patient, and it's like a significant other who kind of help you to go on these levels. Because when you are born, you are psychotic, don't have identity, you don't have any ethical system, nothing, yeah. Then you grow, kind of starting to grow up, you kind of communicate, interact with significant others, so you understand something about yourself, you kind of stop somewhere here. And after, I mean, if everything is okay, you achieve this level. Older you are able to understand who you are, your moral principles, you develop your cognitive abilities, your character, and etc. Not everyone kind of able to do this. There are different reasons for that. Traumas, some disabilities, yes, some intellectual. If you have some complication with cognitive abilities, it's literally you can't learn speak, for example, or you can't understand yourself. And after in that sense, we have not after, because of this, we have different diagnoses. This how this clinical structure look like. My patients, for example, because of this diagnosis I'm telling you about, because of the addiction, they're already not on neurotic level of organization. They, of course, on borderline level of personality, because it's substance abuse. It's diagnosed already. Yes, understand?
Yeah.
And there is also another dimension I won't give you, but it's very fashionable. So this kind of, you will read yourself, yeah? So this level of organization and the other things, it's like different type of character, type of personality, like schizoid, hysterical, I don't know, depressive, narcissistic, yeah? So many of these things. So have you heard? So originally it is coming from here. It's not kind of, you can see that it's very complicated scheme. And it requires a really good psychological knowledge, and you have to know somehow some main issue of psychoanalysis, yeah, to be able to understand and classify a person. Yeah, for example, he is narcissistic, I don't know, type of personality with borderline level of organization. He will be completely different from narcissistic type of personality with neurotic level of organization. So complications of clinical psychology, it's not actually complication, but for people who study psychology, it can be complication. It requires really high level of analytical skills, really high level, because it's literally you have to put, not this psychological diagnosis. You're not psychiatrist, you can't put psychiatric diagnosis, but anyway, you have to be able to analyze, you have to be able to see this connection, and let's call it like a psychological diagnosis, to put psychological diagnosis. You don't have to follow this paradigm, but when, for example, we will be doing some tests, yeah, or when, for example, you will be talking with a person, you have to see, you have to use these analytical skills, you have to see, it's okay, for example, he understands reality good, so you have to be able to create this connection. It's a little bit, for me, I think it's a little bit more complicated than other subjects, because it requires additional skills, yes. Clinical, but to my opinion, clinical experience is very, very useful for psychologists.